because a lot of emphasis you've been talking about is with the eye. And I've heard you say before the eye is basically a window to your health. Explain that.
Right. So we've been talking about the connectivity between Alzheimer's and the eye is a predictor to some degree.
Yep.
Not a definitive predictor, but it helps us screen out people and separate them into high risk and low risk categories. But the eye goes beyond that in terms of predicting other types of disease. And the disease that it's most effective at predicting might be a surprise to you. It's cardiovascular disease.
How's that?
And there's well, when you think about it, look at someone's eye. You see blood vessels.
Yeah.
I can look under a microscope and look deep into the eye and see a whole range of blood vessels that are servicing the front of the eye, the back of the eye, the optic nerve. It's nurturing the health of the eye, and there's so much connectivity that blood vessels are flowing through the brain, through the eye, through the heart, through our periphery and extremities. So let's look at the most simple thing, macular degeneration. It's a major cause of blindness throughout the world.
How does that occur?
Right, good question. Particularly in the aging people. And really what's happening is, and there's two types, the dry type and the wet type, wet being more advanced. What does wet mean? It means bleeding. It means the vessels that are supporting the blood flow to the back of the eye are so weak and compromised that blood is actually oozing from the vessel. Imagine if you had your heart and blood was flowing outside of the vessel servicing your heart. Well, if any vessel is diseased anywhere, it's diseased everywhere.
Okay.
So, I mean, you're in a compromised state. But that's what wet AMD is really the blood vessels are broken down to such an extent that they're actually leaving the vessels and going into the main tissue. Now, statistically, I think there are a couple important statistics that come out of this. People with macular degeneration, obviously weak vascular systems, have a much higher mortality for cardiovascular disease than the average population. So I think the statistic is something like 35 to 40% of people with wet AMD die of cardiovascular disease in 6 years.
Say that again?
There are 40% more deaths within 6 years, and it's all cardiovascular for people who have wet AMD. So it's not the macular degeneration that's the issue. Yes, blindness is an awful thing, losing your vision is an awful thing, but these people are at much higher risk for early mortality. Now, the same is true with cataract. Every disease has its progression and stages. So if we look at cataract, the number one surgery in the world, there are more cataract surgeries than any other type of surgery. And what's interesting is that I think that the number is very similar. It's actually higher for cataract than it is for macular degeneration. 6-year mortality, I think, is around 40 to 45%. Cardiovascular disease-related deaths. So anybody who's having cataract surgery, there are many different reasons for cataracts, but if these people have cardiovascular disease on top of it, undetected, they're the ones that die, and die like flies, really. So how do you differentiate a person with, say, cataracts formed from uveitis, exposure to UV radiation, versus someone who has a systemic illness that's causing this cataract formation? And that's in our differential diagnosis. That's in the blood tests. So if let's just say there's two of us, we both have macular degeneration, and I do blood work on you, and you have clean blood work, no inflammatory parameters, good-looking white blood cell counts, good-looking inflammation levels, you're not in that statistic that is most likely to have early cardiovascular mortality. Me, on the other hand, I have high white blood cell count, I have high levels of inflammation, say through a measure of homocysteine or C-reactive protein. I'm the one in that statistic that's more likely to have a cardiovascular event. But the eye tells it. And right now, what do we do with that very important biomarker about potential cardiovascular disease? Into the biohazard waste, into the trash and away, and the patient's ecstatic because their vision's been improved from, say, 20/40, 20/80, whatever, to near perfect vision through the artificial lens. But the reason why the lens went bad is because of a underlying disease process, the development of misfolded protein, which is a basic fundamental disease of our stem cells that's leading to the improper formation and conformation of proteins that are always being synthesized and resynthesized. So the eye, in a number of ways, these are just a couple of the key main ones that tell us that people with eye problems, it's more than an eye problem. The paper published in 2005 by German and Swiss researchers said a sick eye in a sick body. Sick eyes seldom occur inside a healthy body, and we're ignoring the sick body.
So what you're saying at Real Health or the clinics, at Trent Pro clinics, you're breaking the walls down from the neurologist to the ophthalmologist. You're not just categorizing one, like say get rid of cataract, everything's good now. You're basically looking at systemically the whole body.
Medicine's very siloed. Yeah. Eye in isolation, brain in isolation, cardiovascular system in isolation. It's not in isolation. It's intimately connected to the digestive system, the foods we put into it, the bacterial burden, the lymphatic system. So the only way to look at disease, we're a complex organism, we're a complex integrated organism. I can't move my hand without my brain, without the vascular system, without the nervous system. It's all connected. And to look at any symptom in isolation from the rest of the body is naive.
Fascinating. Thanks again, Tom.
All right, Steve. Nice talking to you.
Yep.